More exposure sites have emerged in regional Victoria less than a week before the statewide lockdown is slated to end. There are more than 850 locations of concern, including more than 100 in Shepparton. 79 new local cases have been recorded overnight. 26 of those remain a mystery, and there's no word yet on how many spent time in the community while they were infectious. And authorities have again repeated their warning that unless people comply with the health orders, the situation will get worse and Victoria's health system will continue to be placed under immense pressure. Let's go to our reporter Stephanie Ferrier now, who is in Melbourne. Good morning, Steph. Take us through today's numbers.
Yes, so as you mentioned, Ros, good morning. We have 79 new coronavirus cases. That's only slightly down on yesterday's figure of 80. I think that a lot of Victorians would have been hoping to see a little bit more of a fall than that. However, we still do, as you mentioned, need to know what the devil is in the detail, just how many of these 79 cases were in isolation for their infectious period. As you mentioned, there were 53 that are linked to the current outbreak. They're still investigating those other 26 into where they fit into the puzzle. This also does come off the back of some really good test result numbers, 50,500 test results processed in the past 24 hours. And this also means that we are up to 660 active cases in this latest coronavirus outbreak.
And Steph, what are the concerns over this continuing spread of the virus into regional Victoria?
Yeah, so we are particularly concerned about the spread up into Victoria's north. In fact, this morning we got confirmation from Echuca's Chief Health Officer there that there was a worker who tested positive at the Echuca community for the aged Warparilla Lodge facility. Now, we have heard that this particular worker was double vaccinated with AstraZeneca already and was looking well when they last worked there last Friday. As a result of this, the whole facility has been put into a lockdown, and the organisation says that they have enough personal protective equipment and clothing for all of the staff, and they're obviously also very carefully monitoring the symptoms of all the residents there. However, we have been told by the health chief up there that a lot of the people within that facility, a lot of the residents have also been vaccinated, which is good news indeed. Now, it's understood that this person who works there works at Echuca but lives just a little bit further south in Canberrans, and in fact we've seen quite a few new exposure alerts out of our almost 870 exposure alerts that are across the state now, coming up in Echuca as well as Canberrans, down a little bit further in Mooroopna, and also of course in Shepparton, where we've got that large cluster. As of yesterday, that encompassed some 85 cases, and we don't know how many of these new cases today are incorporated into Shepparton, but that means that there are around 4,000 people who are isolating there, and that's caused a massive strain, as you can imagine, on this regional city for the health COVID testing, the health services, but also for food and essential supplies as well. So that's why we're seeing around 80 ADF support personnel coming in to be able to help with some of those logistic efforts and get food and vitally needed supplies to some of those people who are having to isolate.
It's a very difficult situation there. And Steph, some jockeys are in trouble for breaching coronavirus restrictions.
Yeah, so what we have heard is that there is Jamie Carr, who is one of Victoria's leading jockeys, and 3 other riders. They have all been banned from racing for 14 days because they were caught breaching coronavirus restrictions by attending an Airbnb gathering on the Mornington Peninsula on Wednesday night, and that was actually after the curfew as well. Of course, we still have this 9 p.m. till 5 a.m. curfew in operation here across the state. So Racing Victoria has launched a full formal inquiry, and the head of Racing Victoria also says that this is a slap in the face to all of the racing industry, which is trying to do the right thing. This also, of course, comes on board at the same time that the Premier also was concerned about the fact that people weren't doing the right thing by not going and getting tested straight away as soon as they had symptoms. Yesterday, in yesterday's new case number of 80, he said that there were a few of those cases who had been out and about in the community for a week or more before they came forward.
Stephanie, thank you. Authorities expect numbers to get worse in New South Wales. Yesterday, they surpassed 1,000 cases for the first time, and a vast majority of those are under investigation. Authorities don't know how they contracted the virus or whether they were isolating. But despite the record caseload, the state government is pushing ahead with a slight easing of restrictions for mid-September, more than 2 months into lockdown. Let's go to Lara Himes, our reporter now in Sydney. Hi Lara, so yesterday was another staggering day of COVID cases.
Good morning, Ros. Well, the figures were huge, 1,029 positive COVID cases, and we have been warned previously that expect in the weeks and the days ahead that figure is likely to rise. Some of the early projections state that we could be reaching more than 2,000 cases too. We've also tragically had 4 deaths that have been linked to the figures yesterday, and the number of cases that are under investigation, 844 or so, around about that. So that is big pressures for the contact tracers to try to identify all the networks of those people and trying to isolate where exactly those people are contracting the virus. We did also have some news, though, in terms of how New South Wales Health are looking at this outbreak going forward. They have introduced mandatory vaccination for their workforce. Essentially, it's a no jab, no job scheme. You will be required to be vaccinated by next week if your first dose, if you are working in the healthcare sector. And for the second dose, you are expected to have that done by the end of November, or at least have attempted and ensure that you've got an appointment for that second dose by that date. So what New South Wales Health are saying is that they are trying to maintain the safety of their workforce. They also want to ensure the safety and health of the patients going through there. So that will be extended to doctors and nurses and also other people within the system.
And what's the latest on restrictions, Lara?
Well, yesterday it was officially announced that there were changes to the public health order. It is a reward for us reaching the target set by the government and also health authorities to make 6 million vaccinations by the end of August. We did make that target just shy of a week, or a week early, I should say. And in terms of the restrictions, they were more easing of what we had. If you live in a local government area of concern, you are permitted to recreate for an additional hour, so an additional hour to that exercise with 5 people from your household. So you might do that in a picnic scenario. However, the caveat is that all of those people will need to be vaccinated. Now, for the rest of Sydney, you can also have that afforded to you. However, you also will be using or be meeting with 5 people within your local government area. Again, they will be required to be vaccinated. In terms of what other restrictions we're going to have, well, the main marker is going to be reaching the vaccination target of 70%. It's likely that we'll make that target by mid-October, so that's when we could see some significant easing of restrictions. However, the question which has been on all the minds of parents across New South Wales is the return to school date. That is going to be unveiled today, but in terms of what we're expecting, in line with the lockdown restrictions that we've already got at the moment, it's likely that Term 3 will still be operating in an online capacity, and we're likely to see the resumption of face-to-face learning really take off in Term 4. But if it's going to be anything like we saw for the Alpha outbreak, it's probably going to be a more staggered approach to that. So we're expecting those details a little later in the morning.
Great, Laura, thanks for the update. The situation in the ACT is looking more promising. At last count, there were 14 cases, with all but 1 in quarantine for their entire infectious period. And the Chief Minister says the 1 case that did spend time in the community is low risk. Let's go to reporter Lisa Glenday, who is in Canberra. Lisa, what's the latest?
Good morning, Ros. Well, we're now into the third week of the national capital being locked down. There are now a total of 190 cases linked to this outbreak, but as you mentioned, 14 new cases were recorded yesterday, and there is some good news. All 14 of those cases are linked, meaning they're either household or close contacts, and only one person out of the 14 spent some time infectious while in the community, and we're told that was for a very short period of time, so this person is considered low risk. Now, health authorities say that they're cautiously optimistic about the trajectory of this outbreak, and yesterday's numbers are showing that things are starting to go in the right direction and that the lockdown is working. Unfortunately, we are seeing more people that are requiring hospital treatment. We know that 9 people are now being treated in Canberra hospitals for COVID-19. Some have pre-existing conditions, but there is also a Canberra woman in her 40s who is unvaccinated, who is currently in intensive care on a ventilator, and she is in a critical condition. Now that we've passed that 14-day mark since Canberra's outbreak began, we're going to see thousands of Canberrans who are going to be released from quarantine today and over the coming days. Not that their lives will be looking much different, given that we are still in lockdown.
And Lisa, what are the next few months going to look like in the ACT?
So even though the ACT is leading the nation when it comes to the vaccination rate, the Chief Minister Andrew Barr is warning that we're still a couple of months off reaching that 80% target of having Canberrans vaccinated. And he says life really isn't going to return to normal until all Canberrans are vaccinated. At the moment, we're sitting at about 30% of Canberrans aged 12 and over who've received both jabs of a COVID-19 vaccine. At this stage, lockdown is due to end on Thursday, but we won't find out until next week whether that lockdown is going to be extended. But Andrew Barr says that we are going to come out of this lockdown very gently. We won't be returning to life as we knew it prior to this outbreak. And he's warned that spring in particular is going to be particularly tough, with Sydney just a couple of hours up the highway presenting this ongoing challenge, even if we do manage to stamp out the current outbreak. So it is still going to be a tough couple of months with lots of restrictions still in place for Canberrans. We are going to hear about some lockdown rule changes for next week, and also an update on today's COVID numbers when the Chief Minister Andrew Barr steps up at 11:45 today.
Okay, Lisa, thank you. South East Queensland residents will have more freedoms from this afternoon, with restrictions eased further after a coronavirus outbreak early this month. Indoor settings will have increased capacity limits from 4 p.m, and up to 100 people will be allowed to gather in homes. Children aged between 12 and 15 are expected to be officially added to the national vaccine rollout after National Cabinet meets today. It is expected parents will be able to book an appointment for their children from next week. There are calls from teachers to be classified as essential workers so they can have access to the Pfizer jab first. Let's take a look at the nation's vaccine rollout now. 55.2% of the eligible population has received a first dose, while 32.2% are fully vaccinated against COVID. And to break that down now, almost all states and territories have fully vaccinated at least 30% of people. Tasmania is leading the way with 39%, while the ACT is close behind with 38.8%. And yesterday was the biggest day of vaccination, with more than 335,000 doses administered.